Hello everyone, this is Dr. Saud Anwar. Today is May 3rd, 2020. Many of you have reached out to me about reopening the businesses. And I think it's important to talk about this in much more detail. So this is an attempt to try and address some principles, some guidance of safety and having risk mitigation strategies for reopening your essential or non-essential business. So with that, I will start the conversation. A few disclaimers I think it's important for us to talk about is that my speaking about this is not a suggestion or support of a specific timeline of opening the state or policy of any advisory committee. So I'm not a part of any advisory committee. I am just telling you as a clinician, a physician, and if I'm talking to you about this, it's not in any way to support a timeline by anybody. That's a different conversation. Those principles are different. There's a separate discussion and a PowerPoint and a YouTube discussion that I already have. So you should look at that for how and when to make a decision about opening the state or a town or a community. And this is based on my understanding of the disease, and it's well recognized impact of the disease may have on individuals and communities. And this is just today's information and up to this point. And if tomorrow we find out that there is a vaccine, or tomorrow we find out that the disease doesn't happen to humans any longer, we may have a different conversation. This is not an official recommendation on a specific business or an industry, but these are principles for people to consider going forward. So basic things that we have to keep in mind. I think even as we have this conversation, we have to keep these concepts clear. There's no opening of businesses, meaningful opening of businesses without safe childcare. You have to recognize that that's going to be a critical piece of the decision making of having safe childcare. There's no easy opening of businesses without a safe school opening, because many of the parents, their children, the age groups that we are looking at, how can they leave the children at home for some of the age groups? So it's important to keep that in mind. No opening of state without the healthcare systems, the outpatient and inpatient at full functional capacity with a resurgence readiness in place. Look, there are risks and benefits of every choices. When we are going to take a risk of reopening the economy, which may be worthy to take depending on the ground realities, which is a different conversation, but we need to make sure that the healthcare systems are completely ready, functional, and able to manage this, which means that the staff and people who are actually being overworked can be fully functional, and also have retraining of the healthcare workforce as well. We have to restock the resources, the personal protective equipments, the medications, and other medical equipment, including ventilators and so on, should be ready. So if things move in the wrong direction, we have a plan in place. Revise the plans, the contingency, and the crisis readiness and communications about this internally and externally are needed. And rebuild the essential services, the rapid lab testing, the workflows, the space, supplies, and the staff. We need all of those things in place before we even have a conversation for reopening, because the worst case scenario of reopening is that things would go wrong. If things go wrong, there's going to be a resurgence. If there's a resurgence and the healthcare systems have not been repleted and ready and functioning, we are in trouble. So rapid testing, contact tracing, proactive strategies, and time for real communication, time communication is going to be important to look at as a basic principles. There's more. We have to have reliable business leaders, workforce, and community groups willing to abide by the social distancing and laws for reducing the spread of disease. If we are in a situation where people are not going to follow the guidelines, it puts people at risk. It puts the healthcare workers at risk. The workforce has to follow the rules as well. And many of the times what we have seen in some essential businesses and so on, that the business leaders or the management have not been as reliable, and that has put people at risk. So that's going to be a critical piece of this puzzle. business safety plan based on the industry specific strategies and individual business specific plan. So it's going to be, you need a safety officer, you need to look at the supply chain of safety and protective equipment, and the legal processes and protection need to be in place from the business safety that has to be kept in perspective. So again, these are very basic things that have to be considered before you make a plan to open the business, or at least be ready whenever a decision is going to be made. And then protection for vulnerable populations or caregivers of vulnerable population is going to be important as well. So every workplace has individuals with health issues, with age groups and so on. We have to be conscious and cautious of how to be able to reduce their risk as well. And if they're taking care of somebody in their home who is vulnerable, we have to protect them as well, because if there's no safety net for those individuals to get exposed, there's a major problem that may happen in that family unit. Technological strategies, how they're going to complement the efforts, is going to be critical, and we'll have more conversation about that shortly. So economy is interlinked, and all pieces of the puzzle of a state and a society and a community, all economies work together. So it's going to be kept in perspective that we have to work collaboratively around this. And if there's a widespread illness, there is no economy. I'm going to repeat this because there's confusion about this. Some people believe that if they build the economy, the disease is going to go away. The disease has its own timeline, it has its own mindset. Unfortunately, it is not controlled by politicians as much, except by prevention strategies. So you have to keep in mind that if somebody is working with a mindset that they're going to build up the economy and the disease is going to go away, it's the other way around. If there is a widespread illness, there is no economy. We know that, you need to understand it, and it's important as a basic principle. In the absence of timely and frequent testing, business must work with the assumption that everyone is infected and at risk of spreading the infection. If we had a magic wand, we would want everybody to be tested so we know the risk strategies, risk stratification capacity. In the absence of that, which unfortunately as of right now is the absence of that, we have to go blindly. And if you're going to go blindly, then you have to have a conservative approach around this to make sure that we are not putting people at risk. Our plan should be subject to change with new information that becomes available or new treatments that are available. But keep in mind, right now, as we speak, there are multiple different states who are at different levels of reopening. There are multiple different countries that are at various levels of reopening, and we have to watch what is happening in some of those situations. And based on our understanding of those situations, we can align or realign or adjust our plans. So it has to be kept in perspective. So with that, let's talk about, this is about, obviously the economy is all interlinked with each other. We have to keep that in perspective, but we have to start locally, and then we will start to look at what would happen broadly in many areas. Today I'm going to be talking about understanding the coronavirus itself, understanding the disease, learning from the medical field about reopening the businesses. There's a lot we can learn from that, and that's something I can bring to the table in our conversation with this. Understanding the concept of probability, building consumer confidence in your business, sectors of economy with examples, breakdown of service industry based on technology options, and questions for businesses for risk stratification and exposure risk-based understanding. Steps businesses should take at this time, some screening questions, technology options, and office space protections. So with that, let's go into the depth of this. So the virus, we have known from the New England Journal of Medicine that the virus can be airborne for some 3 hours. So that is to be kept in mind in a bad case scenario, that the virus could be airborne for about 3 hours duration, or it can be on the surfaces for up to 3 days. So that's something we have to keep in mind. It has to get in our body to cause the infection. If it is on a surface, it is not dangerous directly, but if you touch the surface and after touching the surface you touch your face or your nose, that is when you actually either inhale or through the oral path you can get the infection. Hands can serve as a means of transmission via the contact. And keep in mind, the asymptomatic individuals walking in and out of various places, public places, businesses, may be bringing the virus over to the community, to the people as well. So that's something that we know about this virus very well and understand it, and is something that is a better way to protect ourselves if we understand this. About the disease itself, Well, the majority of the people may be asymptomatic. Some will have mild disease as well. There's moderately severe disease, and there's a severe disease where 15% of the people may require to be in the hospital, and another 5% will actually require to go to the intensive care unit. This is actually the ones which are critically ill, and these are the ones who have a high risk of death. The disease happens in all age groups. Deaths have been reported in all age groups. It's important to recognize that while this is much more severe and compromising in the seniors, it can happen in every age group as well, and we have to make sure we have protection for each and every age group and prevention strategy across the board. So learning from the medical field, there's a good experience that we have. Look, all the hospitals have been open, all the hospitals have been over functioning at full capacity or above full capacity at this time. So it is one of the highest risk field because you have the highest concentration of COVID-19 patients that are there, and we are taking care of them, and the interactions that are happening at the various hospitals are a very large number of interactions. When there is education, when there is appropriate time is used and protections are available and are appropriately used, the disease transmission rates are low. We have heard about the horrific stories of the physicians, nurses, respiratory therapists all getting sick and getting unwell, in some places, in some parts of the world, dying as well. But that was when the PPEs were inadequate and lives were lost. But when you have the right protective equipment, when you're actually giving your fighters, the workforce, the capacity to protect themselves, have the ammunition, if you will, to be able to take care of the patients and protect themselves, they do well. So that's the thing that you can learn from the medical field and apply that to your businesses from that perspective. So I'm going to touch on that in a second. Another concept that's important to keep in mind is about understanding the probabilities. So this is very critical, and then this is going to be helpful. So if there is one individual, this one individual gives a disease to 3 people, and each person gives it to 3 or 4 more people, before you know it, there's an exponential increase in the number of people who are going to get infected. If there was a way to block things here, there's a way to block things here, there's a way to block things here, there's a way to block things at different levels, we can actually slow down the process of the spread of the disease as well. So there is a way we can actually understand these strategies and look at the way to do it. This was the basis of flattening the curve when we have been in social distancing, and we have been in quarantine in some of those cases of developing the disease. We have stopped the spread of the disease, and that's why we are seeing a reduction in the number of cases, and we are seeing the peak slow down at this point. So identified by screening questions. You identify individuals by screening questions, and you don't let them into your business. You have stopped that from happening and then giving the disease to others. You actually have a mechanism of telecommunication with the patient. You're actually talking to them on the phone or through a video conferencing. You have not allowed them to come into your office. That actually reduces the risk of spreading the disease in your workforce or others as well. The staff time of interaction is minimized. So you're actually reducing the amount of time that you're going to have with the staff and these patients, which is going to reduce the risk and then thus reducing the risk of infection further. And the staff has the protection with the personal protective equipment. Suddenly, you have reduced the probability at all of these levels. By trying to reduce this probability, you have given opportunity for the virus to have much less impact on the community. Now, if we do this right, we have to hit 0 of probability. So in other words, we do it in such a manner that even if the probability of anybody getting infected is close to 0, if not 0. Why and how can you do it? Very easy. Screening for the persons before they come to the facility, staff, and the customers both. So here's the key thing. Your staff has to be a part of the screening as well. They need to be educated that if they have an infection, we have to protect them and also others as well. And your consumers have to be screened as well. Try to see what other things we can do via telephone or video communication. In any industry, there's an opportunity to do this, and avoidance of waiting area. If people are sitting in the crowded waiting area, you are actually, the chances of social distancing is reduced, and that actually puts people at risk. If everyone is wearing a mask, the risk of transmission decreases, and all surfaces are cleaned obsessively, the risk of your hand touching something and having the virus actually decreases significantly as well. You minimize the personal close contact for relevant services during the services that you're providing, whether it's haircutting or ophthalmologist's office or optometrist's office or a dentist's office. You're minimizing the personal contact time. You actually have the right protections. You would be able to prevent this from happening or getting the disease or transmitting it. Follow appointments and communications via phone or video technology can be performed. And then if somebody is going to be paying money, then avoid taking cash. Non-touch mechanisms of payment are going to be helpful. So have that mindset that nobody should be touching anything. You bring your own pen. Ask the people to bring their own pen, because you don't want to give them the pen and then take the pen, and before you know it, the person may have the infection and spreading it through that. So it's important to have a completely different mindset around this plan of action. So you have to do this, but it's important that if you're doing this in the right way, you are actually going to be able to help build your consumer confidence. In other words, your customers who are going to come, they would know that you are ready for this. You need to educate your customers what you're doing, and also educate what they can do to help you. Communication is going to be the key. If they know that you are a safe environment and you value safety and you're committed to it, it's important. And this is a message for the consumers who are listening to this, is that if you know, and I'm going to say this a few times, if you know a company or a business which does not treat their employees well, they are not valuing the employees, what is the chance that they're going to value you? So don't go to a company that does not value their employees or their team, and you need to actually make sure that if you go to them, they're not going to treat you well either, because their mindset is that they want to take care of their bottom line at any cost, including sacrificing the lives and well-being of their employees, and therefore they're not worthy of your business. Sectors of economy, and I think this is important to understand and strategize around some of these areas. So this is a little bit more in depth, but primary sectors of economy have been resource based, like the fishing, farming, mining, some of the very basic things that people are doing and are supposed to be part of our economy as well. So we have to keep that in mind. The secondary one is the manufacturing, which is the manufacturing industries, which is very active and remain open in Connecticut. Utilities, construction, they have remained open as well, but we need to make sure that they are following the principles that are important for safety and protection. This is the service industry, is the very big area which needs a lot of effort. So this includes the banking, which has been open, the retail has been open very partially, restaurants very few, hospitality industry has been impacted, healthcare remains open, financial has been not as well, trading, and in real estate, again, grooming, legal services, professional consulting, etc., etc. These are different parts of the service industry, and we'll go into the depth of this, because this is where we have to spend a lot more time. Service industry is where the interaction of people to people is much more at this time, and we need to have a protection. And then outside of that, the quaternary economy is with intellectual activities, with education and public sector related activities are part of this. So this is also critical. The public sector is been functioning effectively and has been there. Education has been functioning through technology as well. So that is something to be kept in mind. But so when we look at these different areas of the economy, we have a strategy for each and every one of them to function, and I'll go through those principles with you shortly. This is again the examples of the service industry that you have, and I think this is a long list of some of the things that we have talked about. This is basically between the recreation and the healthcare, the hospitality, the museums, the membership organizations, the places of worship, engineering and consulting services, the hotels, personal services, and so on. So there, all of these industries are there, and we can categorize them a little bit better, and we can have an understanding how we can make more organized. So I've decided to look at them. The ones can do the work digitally through telecommunication systems, or the ones which will require to have an in-person aspect, and the others which have a mixed component, which have both digital and the in-person aspect. So we know that agriculture, for landscaping and horticulture, you have to have a person come there. Now the person does not have to be in direct interaction with you. The hotel, the restaurants, and so on, you have to have an in-person contact as well. The personal service, including dry cleaning, you have to physically go there, and then text preparation can be done online, which is smart. Hair cutting, grooming, and so on, you have to physically be in that environment. The business services, including temporary agencies, business software development, that's digitally done. Automotive service, you've got to get the car there and then take care of the situation. And mixed miscellaneous repairs, motion pictures, amusement and recreation. We may have to do amusement and recreation through our televisions and computers and cell phones and so on. Healthcare requires both in-person as well as digital. Legal services may need both depending on the situation. Financial services may need both as well if you're going to a bank. And private education can be done through technology and digital. Social services, you need to actually have interactions for social services with physical in-person contact. Museums, zoos, and botanical gardens, actually you have to physically be there. Worship and clubs, that can be done digitally, thankfully, and should be done digitally at least at this point. And engineering and other things would have combination of both. So what I've done is trying to look at which service industries can be managed through digital means or communication systems, and or which can be done in person, and the ones which will need mixed strategies. And now we'll go deeper into what needs to be looked at in these companies or these businesses and industries to be better prepared. So any business has to ask themselves a few questions. And when you ask yourself a few questions, that actually starts to put the alignment of the choices that you would make in that situation, and your risk stratification, if you will. So if can you do the activities online or via phone or video conferencing? So technology option, is that available to you? If that's available to you, then it has to be used. It's a smart way to use it, and you reduce the amount of steps people walking into the space, so that you can actually reduce that density of people, and the social distancing opportunity improve. With the activities require one to be less than 6 feet from the person. So you need to make sure social distancing is possible. So if you have to be 6 feet or more from people, so if you are closer than 6 feet, then you're actually in a danger situation, if you will. Now that's going to be important to have that in place. And is there a way to reduce the density of people in this space? Of course, if you have a crowded place, if you have a sports arena where a lot of people are sitting together, that actually puts you at a risk of having more people, and the density is going to be higher, and the exposure risk is higher. Are there enough resources, training, and equipment available for significant risk reduction? So we use the term PPE for personal protective equipment. I'm going to use PPE, etc., which includes cleaning of the surfaces, making sure that all the surfaces are safe and clean as well. So we need to make sure if that is available. So again, these questions are critical. Are the members, including subjects of the industry, able to follow instructions and make sure that they are participants in reducing the risk? This is important. If you are taking care of children, younger children, they may not be able to participate as easily. If you're taking care of people with special needs, they may not be able to participate as well. So that actually category puts you at a different risk category altogether. And then also, does the job require high risk activity? For example, if you're working with the oral cavity of an individual, or you're looking at their nasal mucosa or upper airway as well of an individual, those are high risk activities, and then that actually exposes an individual to virus if somebody is carrying the virus or has asymptomatic disease. So those questions have to be addressed, and when you ask those questions, people can be stratified in different groups, and then you can start to have better identification plans around what to do in those situations to increase the resiliency, protection of your workforce, but also the protection of your consumers of this. So few questions. Technology is available, social distancing is possible, density can be reduced, personal protective equipment is in place, and you have reliable people that you can work with on your team, or also the ones that you're working with, and there's a high risk activities that are involved in the businesses. These 6 things will help you decide what you can do with the individuals. So if the technology is available, an option is available, well, you need to use it, and if you use it, you're putting people at less risk. If it's available and you are going to actually see if it's partially available, so that you have a partial setup in this situation, and you can look at it differently, or it's not available at all. Let's look at the ones where the technology is not available. If the social distancing possible, if you cannot do social distancing, so you're physically there, then you actually need to make sure that can you reduce the density. And you cannot reduce the density, and this is the part where the PPE, if they don't have the PPE, you're going to be in trouble. We know that right off the bat. In the same way, you can actually look at different parts. If a social distancing is possible and it's a partial component, you can control the density of the people. If the density can be controlled, social distancing can be controlled, then you have personal protective equipment. That's a safe place to be at, or the risk of exposure is going to be less. And then these different categories will actually help us identify where you are in the risk profile in your industry. Now, if you're doing high risk activity and you don't have appropriate PPE, it doesn't take a rocket scientist to figure out that that's something that you cannot do. And that's where you have to have a strategy to take care of that according to that. And then reliable subjects is going to be important. If you have children that you're taking care of, people with special needs, that's going to be an issue to be able to do, even if you look at the direct contact or a lack thereof in this situation. So we have to have a strategy and plan around that as well. So these are the different components that we are looking at, and density reduction. I'll show you more in this situation. So I put these red marks on the high risk interactions. If you have an individual who is partially, technology is going to be used partially, and social distancing is possible, but you cannot actually separate out the density reduction. If you cannot have this density reduction, that means people are going to be close to each other and there's no PPE. This is a high risk interaction. If there is no social distancing that's possible and you have the density reduction possibility but you have no PPEs, that's a high risk situation. In the same way, you cannot actually control the density but there's no social distancing that's possible and you don't have PPEs, you're in trouble. So these categories, and this, you can look at it and pause it if you want to, and then see the different categories right about here, and that'll tell you what's going on the different parts and positions that we have. So then there's a moderate risk situation. The moderate risk situations are the ones where actually you have the personal protective equipment is there, but you at the same time you're not able to do social distancing, so you're putting the risk is still there. So the concept I'm trying to get to is that if you are going to have a direct interaction with people, in those direct interactions, you have to make sure that the individual has social distancing option that is available. If that's not available, you need to figure out a way to reduce the density of the place, and you have to have personal protective equipment in that situation. And if you do not have any of those, then you're putting the risk of interactions of transmission a little on the higher side. So that's the concept I want you to adhere to and understand. In the same way, if you look at the situation where the social distancing is possible, you actually can reduce the density and you have PPEs, that's a low risk exposure. So that's a good thing to have. In the same way, you have low risk exposure. The idea is that your high risk exposures need to transfer and change into low risk exposures. You need to invest in systems in the business and try to change your moderate and high risk exposures into low risk exposures, and you are in a better place automatically. So these are the conceptual parts that I think that you need to start to look at your business and strategize accordingly. So this is again the summary of the situations and the things you can do. So you're a business owner right now and you have a business. So I want you to look at this from the following perspective. Step one, you identify a safety officer for the business. It's going to be the owner, because that's your buy-in, or you need the manager of the practice to be the safety officer. Then you create a safety team. So you need to have multiple people in the party. Safety is a team sport. Everybody needs to be part of it, but some people will be the core group of people who are going to work with you to be able to achieve this. And you get through the details of the work and sit down or have a telephone conversation, video conversation, look at the work workplace layout, the workflow, and the personnel. This is a new territory. This is not what you planned for before. This was the last thing on your mind when you created your place of work and you set up the various systems. Now you're going to restructure the business with a different mindset. You have to have a mindset to protect all your workforce. That is going to be a priority. Then you have to mindset to protect all your consumers. And then you're going to make sure that you adjust the business place for accordingly. Identify the high, medium, and low risk activities that you have in the workplace, and identify their vulnerable staff in the community, in your workforce, because you need to have special protection for them. And identify activities that can be done via telephone, which you do not need the physical presence and proximity. Important thing, you're trying to reduce the people coming to the office, but you're using your workforce to be on the phone or on the computer to interact with the individuals on a constant basis, so you can actually do the critical part of the work that you do, and get the work and continue to do that, but reduce the exposures. And assess the personal protective equipment that is going to be needed, disinfection equipment that is going to be needed. So that is all a conceptual mindset where you can actually walk through your business, look at the business, walk with your team, and see what can be done differently. Create an internal communication system, making sure that everybody in the community, in the business, can be talked to, and then having a feedback loop where the staff is comfortable discussing their concerns. This is a very big mistake that people make. When your staff is uncomfortable about a situation, they should feel comfortable to talk to you and say, look, I'm not feeling well, I have fever, and they should not be worried about losing their job. This is a different era altogether. Will there be some people who will abuse this? Yeah, but most of the people are very interested to keep their jobs. Most of the people are very interested to have their business be surviving as well. I've yet to hear of people who are trying to hurt the business. They want to just be protective of themselves and their families. That's the whole idea. So they should feel comfortable to be able to talk to the safety officer or members of the safety team to be able to do this. External communication is also important, because you need to tell your consumers about the process and protection that you're putting in place to help out. And true confidence would be, again, if you're helping the workers. If you are not taking care of your workforce, you are not going to take care of your consumers, and the consumers, again, need to keep that in mind. I touched on this earlier in my conversation. Questions to screen. Again, this is based on the CDC's new guidelines as well, but we were asking about fever, cough, shortness of breath, and so on. But now we have to make sure we talk about chills, muscle pains and ache as well. Loss of taste and smell, sore throat, and headaches are some of the things that we have to ask of the people. Now, does this eliminate everybody who has the disease? Absolutely not. We know that a significant proportion of the people are asymptomatic, so therefore these questions will not necessarily reduce the number of asymptomatic people coming into your space. But the ones who actually have these, you'll be able to reduce that. So you can actually, just by this, you can reduce 50 plus 60-70% of the high risk interactions to go away and not be able to have to deal with in your workplace. So if people have these symptoms, you want to make sure that they're not in the workplace. Some people want to check the temperatures, which is a good idea. There are a number of things that are available for temperature checking, but you ask the questions, you check the temperature, you can check the oxygen levels as well if you want to, but they will still be able to reduce your risk of people who are sick to come in. It will not eliminate it, as long as people know this. So technology options to simplify things. So again, you need to have the teamwork. You have technology which can do wonders with the cell phones that are available, the computers or things that are available as well. Can you do this through a conference? Ask people to bring their own pen. You never thought pen would be technology. Well, it's a very important technology, but if you're going to give your pen and you touch it, you have to clean it as well, and so it reduces. So ask the people to bring their own pens if they can. When they're making their payment, make it through the mechanisms where it's a minimal or no touch mechanisms. Use your phones, cell phones, or other phones as much as you need to or you can. And this is something that for the waiting areas, you know how the restaurants have these buzzers. Now this is going to be a good thing to have in the office. You can give these buzzers to people who come in, and you hand it over to them, and they can sit in their car and not have to be sitting around in your waiting area. So When the time comes, you call them out, and then they will come in and they'll go directly to the room where they need to be, or have the interaction where they need to be, so that they can be in the safe space of their own cars. Again, this is something the restaurants have been using for a long time, and then this has actually served them well. And now I think their use is going to increase in a number of different industries. So just something to look at. Again, in the space inside the office, you can do a number of different things to help out as well. Look, if you have sofas which are cloth based, they're difficult to clean. Having that covered so that you can easily clean the surface once you have used them with the various material that is there, the Clorox or other things that can be used. I do not invest in Clorox or anything, I just use that name. I also think that having the personal protective equipment of your staff, even including having the shields, is going to be important. Having the areas to tell where the social distancing is going to be there. Reminder that social distance is going to be practiced. People tend to forget it because we work with our reflexes, and our reflexes have not been set up yet to work in a different way. Everybody needs to have their masks and gloves depending on the industry, but you need to actually, even in all industries, you should have your masks and gloves available to this. This acrylic way of having these protections, just like in banks that they have them, you may need to have them in many of your interactions. That actually reduces the exposure, reminds the people he's not wearing a mask. If you're wearing a mask and if you have this, you're reducing your risk significantly. This is somebody who's working on the nails, be it tattoo parlors, nail salons, and so on. They can actually have the similar acrylic setups as well. And after every interaction, they need to actually clean the area up so that the next one feels comfortable. So there's a plan of action in the systems, and then the plan of action of the inside space and your interactions that you are going to have, and then reduce those exposures. Restrooms, you have to be obsessive about this aspect as well. Remember, when you go to the restroom, there's a sign that says, please, before you leave, clean up. Well, you have to change the sign as well to say, please, before you use, clean up. So you have to do it before and you do it after. So use has to be when you're using it, you have to do it. There should be gloves available for individuals. They need to be hand sanitizer available, and there need to be a soap available as well. And then you need a number of different products for cleaning, and any part of your body that is going to touch any object, anything, needs to actually be cleaned before and after. And that's going to be the obsessive way of taking care of this. The virus, if it is present in stools, it is present in urine of individuals who have it. So just keep that in mind. So the cleanliness in the restroom is going to be obsessive. So what we have done is we have talked about risk stratification, understanding your business, which you understand it well, reassigning and adjusting your business mechanisms and plans that you have. And then we have looked at what can be done to try and reduce that risk. What are the systems that you can create? How do you create a team around some of these businesses and try to change this? This is actually just my way of giving you the tools and understanding what can be done, and then you reassign, replan, and adjust your business accordingly. And depending on what the timeline you will determine, or the policymaker or the administration can determine, you can actually have your own plan in place in advance. So you need a plan of action in your business, you need a plan of action in your homes, you need a plan of action in your towns, you need a plan of action at the state level, and they may align and they may have different timelines, but your business timeline, you need to be able to control that. I will end with a very important thing, that by failing to prepare, you are preparing to fail. I think Benjamin Franklin said this, and this is something, just giving you the tools, getting ready. I know people are excited and looking forward to working, but the last thing we want to do is to make a mistake. The last thing we want to do is to get our workforce sick. The last thing we want to do is to get our consumers sick and the community sick and not have the preparation in place. So all of these aspects, I know it's a longer talk, but it's worthy because it's an important topic, and it's going to be there. And if you have questions, reach out to me. I may be able to answer some of the questions that you may have, and I'll at least try to address them. And if you think it's going to be beneficial for somebody else, send this over and share it with people. Stay well, stay prepared, and please protect yourselves and your families and your consumers and your businesses. Thank you.